Hey everyone, welcome to the answer session of this week's Ask Dr. Dan. This week again, we are talking about high-dose laser therapy. This is a completely non-invasive treatment using high-dose laser to treat many different conditions, which we will be talking about during this session. So let's get to the questions. The first question is, how long is each treatment and how many treatments are needed? So most treatments are about 10 minutes. That being said, if it's a really big area, like let's say you're doing the lower back and they're also having sciatica, so you're going down the legs as well, it can be like a 15 or 20-minute treatment. But that being said, the bulk of treatments are about 10 minutes. How many treatments are needed is variable. So what we normally start with is 6 treatments, and that will typically be pretty good for more acute conditions. However, sometimes if things are chronic, like chronic lower back pain or arthritis or things like that, it may take more sessions. So normally it's somewhere between 6 to 12. That being said, we treat some patients continuously for several months. For instance, we have a patient that had a motor vehicle accident 30 years ago and had surgery on his neck and back. And when he came to us, he was very, very hunched over because of all his pain and his prior surgeries. And we've been treating him for several months with the laser. And with that, he's actually standing up straight and feeling much better. So there's no real limit to how many you do, but where we found that kind of sweet spot for most things is in that 6 to 12 treatment area. And then occasionally, down the road, you might need a tune-up treatment here and there. The second question is, what does it feel like? So that's a great question. As opposed to cold laser, which again is a low dose laser where you really don't feel anything, the high dose laser feels very warm. It actually feels really nice. It's a nice heat to the area. It gets very deep. You actually feel it penetrating into the muscles. Sometimes we just have to make sure that it's not getting too hot. That's usually if it's a very small area we're treating, and sometimes we just have to lower the energy a little bit. But overall, it's an extremely comfortable treatment. It's one of the few things that you do in medicine that actually feels really good while you're doing it. Next question. Can anyone do it? So there are very few contraindications or reasons why people cannot do the laser therapy. Really, the only reasons that people could not do it is if they've had previous cancer within the last 5 years, like a solid tumor in the area of treatment. If it's been removed and they have been cancer-free for at least 5 years or more, you could still perform this procedure. And also, you don't obviously want to do it on a pregnant belly, even though it may be safe. You don't want to test that at all. So, but other than that, almost everybody can do this procedure. It's completely non-invasive again, so there's no clearance involved. Any other kind of health conditions like diabetes or heart, it will not affect that in any way. So it's a very, very safe treatment that most people can do. Next question is, what can be treated? So the laser can treat really most conditions. Again, really the only place you don't want to do this is in the face area because you have to protect the eyes. Obviously, you don't want to put laser in people's eyes. We wear safety glasses to prevent that anyway, but you don't want to treat over those areas. But this could be used for muscle injuries, ligament injuries, tendon injuries. It helps with arthritis. It actually helps some people that even had surgery. It helps with wound healing and scar formation. It can be used for really many, many different things. There's very little that this can't do. Now, there are some depending on what's going on, sometimes there are better treatment options, but for a really quick non-invasive treatment, this can be used for almost anything. The next question is, how long do the results last? So again, that depends on a couple of factors. One, exactly what the diagnosis is, and also how long it's been going on for. So something like acute inflammation, let's say a sprained ankle, and you're doing it to get rid of that inflammation and just promote some healing, get the swelling down, it can be a permanent result. For something like chronic back pain where you have a radiculopathy, meaning that the nerves going down the legs are irritated, sometimes you do need tune-up treatments every once in a while, every few months. because there are more chronic conditions, also arthritis. It's not going to get rid of the cartilage wear and tear that arthritis is. It's going to help with the inflammation of arthritis, and occasionally that inflammation is going to come back, so you might need some tune-up treatments here and there. But typically you'll get pretty long relief and occasionally need some maintenance treatments. And then the last question is, are there any complications with this? Potentially, yep. So the key to the laser is, again, this creates a very intense heat response. So when you do the procedure, what you have to do is you have to keep the handle moving. So if I was just to kind of hold it there and leave it there even for a couple seconds, you can cause burns. So obviously you don't want to do that. Really, the complications come in if you're not doing the procedure properly. Other than that, there is really no complications of laser therapy, especially high-dose laser, and it's very, very safe. So those are all the questions for this week. I hope you have a great weekend. Remember to follow us on all of our social media pages, on Facebook at Apex Center for Regenerative Medicine, on Instagram at RegenerateNJ, and on YouTube at Apex Center for Regenerative Medicine, where you can also see all our past Ask Dr. Dan episodes. So again, have a great weekend, and remember, don't operate, regenerate.